Welcome, Dr. Jess, to the Girlfriend Doctor Show. It's good to have you here.
Thank you for having me. I'm honored.
Well, I'm excited to chat with you today. There's a couple key topics that come up over and over again, and one is herpes. Herpes virus is very, very uh, common. I hate to say it. I hate to use that word, common, and also shingles. And this week in my medical practice, I had a young woman in her mid 40s with a outbreak of herpes shingles in the vulvar area. And it was like, it's painful anywhere, let alone in the vulvar area. And so we want to nip that in the butt right of the way. And like thinking of these things, shingles is something that people worry about when we get older, but yet we're seeing it in younger and younger people. And we want to talk about preventing it as well as treating it. And I know in your own journey and working with mystery illnesses and as a functional medicine doc and specialist, that these are, I mean, this is like, an immune, like how we can support the immune system, how we can get to the underlying reason. So eliminate the concept or fear about having shingles in our future, whether we've had herpes or not, right? Herpes 1, HSV 1 or HSV 2. And so I definitely want to just jump in and talk about some of the integrative ways and functional approaches we can take to take care of this.
Absolutely. I know. And I hate it because people I feel so judged and have so much shame around things like this. And it's so common. I think 1 in 4 people, so 25% of people have HSV2, and 90% of people are seropositive for HSV1, if not more. And so, an Epstein-Barr virus is a type of herpes virus as well as shingles. So everybody has some form of something.
Some kind of
And
viruses within us living, right? We just want them to behave, stay dormant, and not rear their ugly heads.
That's right. That's right. Now let us know that they're there anyway. So what I like to do for herpes viruses, besides herbal treatments, one of the things that I use is ozone. And another thing that I do is parasite cleansing. And let me explain a little bit about both. So ozone, and specifically, I really like ozone suppositories. Have you ever used those or seen
Yes,
those?
absolutely. Ozone vaginal suppository, rectal suppositories, ozone insufflation of the bladder, IV
I
ozone. Yeah.
I love it. And so ozone is O3 molecules, 3 molecules of oxygen rather than two that you guys are used to. And what this does is it hyperoxygenates the body. And that really helps to release the oxygen in the tissues. And when it goes into the tissues, what ozone does is it converts into oxygen with a singlet electron that's a reactive oxygen species. So it mimics reactive oxygen species in the body. It also turns into H2O2, which is hydrogen peroxide, which is used as a defense naturally within the body against pathogens. So it's like sort of mimicking the acute inflammatory response for in the body, which helps to reset and modulate the immune system for a lot of people. It's very anti-pathogenic, antiviral, antibacterial for a lot of people. And so even I love ozone even in the tonsils, even in tonsillar injections. You have a lot of dentists use it, obviously in the mouth for anaerobic infections as well. And so as you can see, quite anti-pathogenic and very great if you can get a suppository physically in the area, like maybe the vaginal canal for herpes 2 or something for women would be really helpful in this way. And so people have really, or the people I've talked to, the clients I've talked to have really gotten huge benefit from things like ozone IV or ozone suppositories. Insufflations, you can do it vaginally, in the ear, in the nose. This gets rid of marcons for mold for people who have mold colonized in their nasal passages. So extremely versatile and useful for people. And you don't want to directly breathe this. It is a respiratory irritant for people, but this is what our city water cleans the water supplies with. The municipal water is cleaned with ozone. So kind of cool. And then the other thing I use is parasite cleansing. And let me explain that. In a lot of the studies, what we have seen is that parasites and viruses interplay within the immune system. Kind of like I like to call them frenemies, if you will. And they kind of can reactivate each other. And in some of the studies, for example, a parasite called Leishmania has a virus called HTLV that can actually, it's a retrovirus that can interplay and make the parasite more virulent because that virus is present. And so sometimes we can parasite cleanse people and actually get rid of the viral interplay with parasites if people show that symptomatology or their tests come up positive.
Yeah, no, I think that especially in shingles, we think, okay, there's nothing to do about it, but throwing high dose antivirals at it, like Valtrex 1 gram 3 times a day for even 2 weeks, and front loading that vitamin D, NAC, zinc, other immune support that we can do, but IV ozone kind of works to get to the issue quickly and reduce that viral load. So can you talk about that too, using IV ozone?
Oh yeah, absolutely. It's the doctor term is called major autohemotherapy, if you will. And there's also something that's even a bigger gun than that, which is EBOO, which stands for extracorporeal blood oxygenation with ozone. So lots of big mouth, big term there. And what that means is that it's sort of like dialysis for filtering your blood with ozone. So we're cleaning with major autohemotherapy. Sometimes we'll take out a pint or two of blood. We'll push ozone into that blood and it turns from maroon when you mix it to bright red because it's so oxygenating all of your blood so much. And then we drip that back into a vein. With EBOO, it's literally the whole blood system is pushed through and filtered through a machine and then filtered with ozone and put back into the body. So EBOO is really nice because you won't see a lot of those healing detox reactions because the blood is so filtered before it's added back in.
So
Now,
clear to clarify, you're not seeing the die-off reactions from the kill from the ozone.
correct. Absolutely. Because as you mentioned, so anti-pathogenic, it can knock down viral loads. So we see a lot of people who go in and get IV ozone or EBOO for recurrent things like Epstein-Barr infection or mono or, long COVID even. There are actually published studies that show that ozone is extremely beneficial in things like long COVID.
Yes, yeah, I agree. And dealing with any post-viral syndromes, it's an excellent ancillary. And you can add it on. You can do the IV ozone. In our clinic, we do the IV ozone through
Mm.
filtration, ozonate the blood, and then bring it back into the body. So the classic IV ozonation. And it's so cool when you have this bag of dark red and then it comes back into you bright red, and it feels really energizing and just making me think, okay, it's been several months since I've had IV ozone myself. I think I need to go hook myself up and and get this done right away. So
Yeah.
it certainly is one of the things that I like to use, and especially in cases of viral illnesses and in general, like mold toxicity, et cetera. So, IV ozone is something that, many places are offering this therapy. There very few offer the EBOO, EBOO, that extensive process, but many places are offering the IV ozone, and you can do a sequence of those and get excellent, excellent results as well. Even after one treatment, patients can feel so much better. But, you came into this world like you were classically trained. So I want you to talk about your training now and also dealing with your own mystery illness. Like what's been going on? What really made you dig deep into functional medicine and
Mm.
come up as such an advocate for
Yes.
for a client's health?
Yes, thank you. Yeah, absolutely. So, it seems like a different life ago now at this point, but back many years ago, it feels like I was a hospitalist. And for everyone out there listening, that means a doc who is trained in internal medicine, and then works in the hospital. And we admit a lot of the primary care physicians, patients who don't have time to see patients in the hospital any longer and kind of take over care until they're discharged. So I was sort of the quarterback of the team who had to consult all the specialists and do all the paperwork. And, I just started seeing cracks in the system. I just started seeing, I don't know what happened. I just really was like, why are we feeding Cheetos and Diet Mountain Dew to people in the hospital? And why do they have Coke and Pepsi contracts? And why is 40 medications on a discharge summary actually health? This can't be health, right? I mean, really? I feel like I'm not helping anyone right now. And I started to say, maybe my fellow colleagues would like to hear about this. And many of them did not. I was mistaken. And I kind of I kind of got labeled a disruptive physician. And the last straw was that I ended up writing in a patient's electronic medical record that they had been on Prevacid for 8 years when the package insert said 6 months to 1 year. And the primary care physician, as the outpatient, called the lead hospitals to complain about me. And at that point, when they came to confront me about it, I quit. And I could at the time. I didn't have a family. I wasn't married. I felt maybe a little braver. I would build the parachute on the way down after I jumped out of the plane. And
Mhm.
that's what happened. I probably would have been a little more careful had I known I was going to make a quarter of what I made in the hospital, trying to make a business as an outpatient physician in the holistic root cause world. So after that, I started to shadow a naturopathic doctor and then worked at Whitaker Wellness under the mentorship of Dr. Julian Whitaker, and really learned all about herbs and all about holistic medicine and getting people off of pharmaceuticals rather than putting them on more. And that really propelled me. I ended up getting trained in Gerson therapy. I ended up getting
What is
trained.
Gerson therapy? Can you explain that?
Gerson therapy was created by Dr. Max Gerson who was from Germany in the 1930s. He came to America in New York City specifically and started doing juicing and coffee enemas with some very targeted supplementation for tuberculosis at the time. And what he found was that it helped tuberculosis, it helped people's pain, and lo and behold, people who had concurrent cancer, it helped their cancer. And so he created a whole protocol, and really, that is what got me into enemas and colonics. So even though I don't see cancer clients or patients anymore, I do really still love what I was taught in Gerson therapy about the magic of plants and vegetables and enemas and detoxing. I took a lot of those tidbits with me, I guess.
And
So
so when you say the magic of enemas, now that's a really hard one there. So I think people listening are like, wait,
yeah,
hold on a second. Wait,
yeah.
it may never have had an enema or coffee enema or colonic. So, truly, does the benefit outweigh the discomfort?
I'm right there with you. I've definitely, anything I recommend to people, I've definitely done myself. I've definitely been the guinea pig. And so I've absolutely done coffee enemas. I've absolutely done colonics. And to be honest with you, it's sort of a preference. So colonics actually bother me more. And that's with a professional, usually a nurse at the bedside with me who's doing the colonic. And it's sort of like a workout for your bowels. And it can kind of get crampy and uncomfortable. It can. But then afterwards, you have the clearest head. You really have any brain fog or fatigue is gone. And with coffee enemas, it's more for, I would say, the not faint of heart because you have to do that at home yourself.
Mhm.
And so it's a DIY that many people are not ready to attempt. And it can you have to kind of know what you're doing a little bit. You want to lie on your right side. It is a liver cleanse. It does help produce some things to help move the bile and the production of bile and the production of glutathione. And I've seen really remarkable results with people, but it is not something that I would just say, hey, if you're out there listening and you've never done any sort of like drainage or detox, don't go jumping into enemas. It's something a more advanced detoxer would know about and sort of attempt, I would say.
Yeah, and definitely you're pushing like caffeine pushes phase one detoxification. So you've got to balance it with phase two support because phase one and caffeine really pushes that initial free radical, right? Reactive oxygen species. And so you want to make sure we are eliminating them through phase two appropriately. And so, I mean, I think that's really important to consider. So, like when you're doing these things, like you said, Jess, is not just, okay, let me try a coffee enema, not without supporting phase two. And the same thing with colonics, right? The same thing with colonics is you want to reseed the gut, but it's nice. I mean, it's a nice thing to clean up. And now I'm thinking, okay, well, it's probably been years since I've had a colonic and or a coffee enema, definitely pre-pandemic. So maybe I should just go do another one sometime soon. And so you guys, we're talking ozone therapy, colonics, coffee enemas, and
All the
it's just
things.
like these are kind of fine-tuning things to enhance your body's detoxification process and elimination of the like you said, frenemies within us and actual frank enemies within us that cause disease. And this viral, like, viral illnesses now post-pandemic is
Oh my gosh.
more exacerbated than it was pre-pandemic for sure. Epstein-Barr virus, Lyme's disease, autoimmune issues that are coming up, shingles, herpes. And so, we've got to really support the immune system in this. So you were saying when you went through your transition, you worked with the naturopath, and then you're like, okay, now I'm going to start doing stuff on my own, and then you had your own personal health crisis.
Right, exactly. I really started to kind of empathize with a lot of my patients at the time, because I got burnt out. It's really easy to do. I feel like we are given a badge of honor for being the hardest working employee. It's really, how many hours you put in is looked at as a badge. And sometimes is not always good. Sometimes we need to learn to be a human being instead of a human doing all the time, which that's what I was. I was a little machine driving all over California, working in multiple clinics, training, and really not making the money I used to while still having the same bills.
Mhm.
And
I
I
hear
kind
you. Been
uh-huh,
there.
uh-huh. Yeah, it's not sustainable.
Yeah.
And so I started to kind of feel the symptoms that a lot of women were coming to see me for at the time. And I had to catch myself. And recently it happened again. And so it's very easy to see other people. It's very hard to see yourself, even as a physician. It's very hard to objectively see yourself. And so sometimes, just like all you guys out there listening, even as a doc, I catch myself a little too late on the burnout and the sympathetic overdrive. And in my opinion, that is a key component to autoimmunity.
Yeah, no, I would agree there that burnout, experiencing that cortisol winning and the rest of us losing, and we get into this catabolic state, and it gives the opportunity for other things to take advantage, right? You know that
Absolutely.
with boundaries. I mean, from the small microcellular cellular level to the bacteria and viruses and parasites living within us, to to your household, to your community, to your relationships. I mean, there becomes a loss of boundaries, of healthy boundaries sometimes as well.
Absolutely. And when you're at tipped in sympathetic overdrive, it's just like your whole body is like out of homeostasis a little bit. So the neuropeptides, the neurotransmitters, the hormones are all released somewhat differently. Blood sugar regulation is off, all of that. And for me, over time, I was so stressed for so many years that I like dumped minerals out of my body. So the first step that really helped me to ground my moods, my hormones, and stop a lot of the hot flashes I was experiencing because I'm now 46. I'm almost, I'm close to menopause. So, these things are starting to happen to me. But really remineralizing really, really helped me because I've gone years with stress and then getting in a sauna, taking binders here and there. And my body really needed some needed minerals for my hormones. So that really helped me when I was stressed out, when I experienced what a lot of my clients and patients have experienced.
Yes, using minerals, electrolytes, have a key. You think of our bodies as a battery, right? Battery of producing energy. I mean, you need to have good conductors, and so minerals and electrolytes are part of those conductors.
Absolutely. And I also feel like, over time, um, things like heavy metals can create some ionic mimicry in our body in certain ways that look like minerals. So mineralization really helped me with a number of different things. Um, but yeah, now that I am not stressed anymore, my labs have returned to normal. My blood sugars have returned to normal. My weight and inflammation has returned to normal. And so this has been kind of the new thing I've started to help women with who come to me with nervous system dysregulation and histamine problems and MCAS, mast cell activation syndrome, and a lot of other weight loss resistance, insulin resistance. A lot of these things are come from the place of being burnt out,
Mhm,
along with some
mhm.
other things, depending on the person.
Yeah, and let's talk about histamine reactions and MCAS because this is something, again, becoming more common. People are becoming aware, oh my gosh, I have a histamine sensitivity. So let's talk about what that is and what to avoid definitely and how to repair and heal from it, completely heal from that.
Yeah, it's something that really bothers so many. I usually see women I don't want to rule out you guys out either, but it's usually women I see. And it is so much worse than it used to be. I agree with you. I've seen so much more of it. And what is it exactly? So mast cells are the kind of some of the first responders in the body, the cells that you guys have, and they present antigens along with macrophages, and they have some noxious substances in them, things like chymotrypsin and histamine, and they can release these substances when they see a foreign intruder as a defense mechanism. And sometimes the body can be a little hypervigilant and overreactive. And there can be a number of root causes for that and reasons that that happens in the body. And nervous system dysregulation is one of them for that as well. That is a big component. Mold is another one, mold and Lyme, biotoxin illness in general. That's a big one. Breast implants are another one. And so that's your body's way of trying to protect you. It's not that you're broken. It's not that anything's wrong with you. So your body's very smart and it's just trying to protect you and seeing everything as a foreign intruder, being very hypervigilant in that protection. And so what do we do about this? Well, I usually like to try and get to the root cause for people. I take a very extensive intake and history on them to find out any antecedents, triggers, or anything that may have caused or contributed to this. And usually what I find is it's a combination of type A, not wanting to let go of control, sympathetic overdrive, and some sort of water damage, sick building syndrome is huge for this. Palpitations and MCAS, and then sometimes Lyme and SIBO.
And so, what are some first steps when you recognize this? What are some first steps to heal from it?
Absolutely. I actually really like to look at people's mineral status and see if they
Mhm.
need remineralization for the nervous system aspect of it. I also really like to look at different herbal treatments and nervous system dysregulation courses, things like Primal Trust or DNRS that can really help calm people down slowly.
I
But
just want to put a shout out for Primal Trust,
the
right? For nervous system dysregulation. It's something that we've recommended to patients regularly. It's a great program.
Dr. Cat is amazing, and she's the creator of the program. She was bedbound due to her nervous system. I really respect what she's built. So for anybody out there listening, I concur. And so, yeah, some herbs that I really like. I love stinging nettles tea. I love DAO enzymes. Sometimes
Yep.
people are low in that naturally and genetically, and that's the enzyme that chews up histamine when it's out in the bloodstream. So it's really important to make sure you have enough of that enzyme. I really love things like quercetin, vitamin C. There's a number of different herbs that can act and be lovely for people with this. And so that's really then I look to people to see if they have any roadblocks for healing the histamine, anything stuck inside their body that doesn't belong there that's contributing to this. And sometimes that means we open drainage. We make sure that you can have enough proper bowel movements a day, that you are sweating accurately within a proper amount of time in a sauna or hot bath, that your liver and your bile are working properly. And then that really is enough sometimes to help people kind of calm down when you take those steps.
Yeah, and that sweating is a really big deal, right? Sweating is a
Oh,
really big deal. It's one of the ways we detoxify. Exhale, urination, defecation, sweating. So those are the key ways to eliminate toxins from our body. And with sweating, some people like when you have someone, I'm thinking of a client I recently had with Lyme's disease, and she
oh,
just wasn't sweating. She wasn't sweating in her sauna. So it really did a lot of lymphatic drainage opening
yes.
pathways and really worked on lymphatics to get her sweating again. Now she gets in the sauna and starts sweating immediately. But I mean, it's taken quite a long time, at least 3 months to get to this
Absolutely.
point.
It's really hard. People don't know that they should be sweating. They think it's nice just to have a glow. And they're really surprised when you tell them, no, you should really be able to break a sweat with at least within 10 or 15 minutes in a sauna, in my opinion. And that's because, guys, think about it. It's lymphatic system is stuck, and also mitochondria in the body, your cellular health, they make ATP, which equals heat. And so when you start to sweat, you're actually showing that your mitochondria can produce energy again. Your cellular health is improving. And so I think that's such a big deal too, actually. I really That's one of the things I screen in everyone.
Yeah, if
Yeah.
whether or not they can sweat and how long it takes. So with that, because thinking about laser therapies, laser hair removal therapies of the underarm to remove hair from the underarm, what do you think about that?
That's a good question. You know, I haven't seen any horrible outcomes from it, but I still don't know how much that is going to be good for the follicles and releasing sweat or toxins from under all those. There's so many lymph nodes here, so many. And these are our termini where we drain right here next to where you're getting the laser hair removal. What's your opinion?
Yeah, I think, I'm jury's out, but I'm just
Yeah.
think, okay, it's important to sweat. It's important to have that follicles, definitely. And if you want to laser hair removal, legs or arms or, face, chin, if there's something there, but the underarms, not
Mm,
keen on it. Not
yeah.
keen on it. I'm like wax is great.
Yeah, I agree. The waxer shape, guys. Absolutely.
Yeah.
Yeah, for
Yeah,
sure.
so I agree with that, and that it's an important aspect. And so, in your recovery from burnout, you said you're very sensitive and you're aware. Okay, what are some of the stop signs that you've put up to check you when you're getting to that stage again? Like, what are some of the lifestyle pearls that you've incorporated into your life to keep you from getting burnout again?
Honestly, this is a very much deeper question than what I think you originally intended it to be for me, but I'm going to go there.
Go,
So
go.
I think this goes all the way back to my childhood, because I am very much a fawner, a people pleaser. I have now dug into the world of secure versus anxious versus avoidant attached relationships, and I am a recovering anxious attached, which means, I will chase after people. I want everyone to like me. It's very important for people to like me. And that is not healthy because that means you often don't have good boundaries with people because you'd rather be liked than keep your integrity sometimes and, or that you blur the lines between where boundaries should be. And at that point, if you want everyone to like you and you're doing things for everyone else, you're not taking care of yourself. And
Mhm,
that is a lot of where my burnout actually existed, was in that gray area where I hadn't completely healed. And it comes from my childhood, actually. So that was a big epiphany for me to realize, I need to work on the fact that you're not going to make everyone like you. You're not going to make everyone, you're always going to be too big, too small, too round, too soft, too hard for someone. And that I needed to like myself. And when I started to set boundaries about taking care of myself versus other people's needs, boundaries versus my personal life and work life, boundaries between my colleagues and my clients and my family and myself, that's when everything kind of changed for me. And I started to not experience the burnout as much. And that was some hard knocks in life to learn that lesson. I mean, really, more than once, like a dumb, thick-skulled person.
mhm,
Yeah, really. And so that's really what I look for now is in my self-care. It's not just about, a bubble bath and a massage. It's about, am I letting in thoughts that are for my best interest and in my best growth and that keep me positive? Am I dwelling on things that I can't change? Am I worried about other people that I can't change? Those kind of things. It was more in my mental and emotional um, health, and that actually ended up influencing my physical health in the long run.
mhm. Improving your physical health. I mean, I really do look at that as, our external environment affects our internal environment and vice versa. So, like, if we don't have good boundaries on the outside, there's cellular damage occurring, right? And certainly
Oof.
with increases in some of our adrenaline and cortisol and other stress hormones, we have that. I say those are the keys to unlock the door or break through a healthy boundary, a healthy fence. So, for example, it creates the leaky gut, the leaky brain, the leaky heart membranes. I mean, just name it. It disrupts our membrane health, our cell membrane health, and we've got to fix that.
I mean, you said it. That's exactly what happened to me. I mean, I ended up with an emotional traumatic brain injury. There's now studies that show that you can have an emotional traumatic brain injury from narcissistic abuse and other types of abuse. And that, guess what? The brain is attached to the gut. What you injure here, and vice versa. And I ended up with leaky gut, horrible numbers of zonulin and calprotectin on my gut test, which shows or indicators of leaky gut and inflammation. And really had stripped of B vitamins completely on my CBC, on my blood work, no B vitamins, low vitamin D, homocysteine high, which is a marker of inflammation, another
Yeah,
inflammatory
impaired.
marker.
Yep, and
CRP
impaired
was
methylation. Yeah.
CRP was 8. And I'll tell you what,
Yeah.
I did not, that's all from stress. All of that was from stress, every bit of it. It unwound every membrane. It stripped me of minerals. It caused brain injuries because I didn't have minerals your brain needs to function and make neurotransmitters and hormones. And so everything just unraveled from there. And I saw it in myself. So what you're saying is absolutely the truth. And I have MTHFR, but I'll tell you what, Dr. Anna, it was not activated until after all the stress I went through in the
Mm,
last 4 years. And the
mm.
environment signaled my genes and turned on epigenetically that MTHFR mutation, which made me not be able to detox and methylate and think properly and all the things. And I now am very strict on taking B vitamins. I'm very strict on my stress because I believe if I can turn those on in a negative fashion, I can turn them off in a positive fashion.
Absolutely, absolutely.
Yeah,
I couldn't agree. One of my practices and to keep myself in a I say alkaline state or an oxytocin dominant state
I love
is
that.
is one, find the humor and everything. But before I even open my eyes in the morning, I always ask myself, where did I see love yesterday?
Mm,
What am I grateful for? And where did I laugh yesterday or where could I have laughed more? Right? Like think back on the
love
funny
that.
experiences or the things, and I always tend to take myself too seriously. So that's an important exercise for me. So laughter, love, gratitude, all key practices in healing, right? It's all key practices in healing. A
Beautiful.
funny story. One time at a medical conference, I think it was a Zymogen medical conference, Dr. David Perlmutter was speaking on stage, and this is when he was releasing his Grain Brain book, I believe. And he read he read Horton Hears a Who to us as part of his talk. And Horton Hears a Who, you guys, Dr. Seuss wrote Horton Hears a Who. It's about this elephant that hears on this small like dandelion flower, when it's all puff essentially, this this call for help, and everyone thought he was crazy, and he was just talking about the community, right? The community that we don't see, the
Yep.
bacteria in us and around us that we don't pay attention to. So Horton Hears a Who is your reading assignment for today. Bibliotherapy, bibliotherapy. Yeah.
I love it. Absolutely. I don't remember that book, so it's going to be my homework too, actually.
Oh my gosh, so good, so good. I already got my granddaughter a copy. I already got her a copy. So, yeah, so it's things like this that make a difference in repairing. So in your clinic, you do the IV ozone, IV vitamin therapy. What are some of the other modalities you're like, oh gosh, this is wonderful if you can get it?
If you can get it. Yeah, let's see. I love, you mentioned the lymphatic system earlier and how you worked a patient's lymphatic system and got them to sweat. I think the lymphatic system is so important and completely overlooked in many cases. And
Except in Chinese medicine and acupuncture.
that's true.
That is the
Th-
focus of much of that. Yes.
That's true. You're right. I shouldn't leave that big side of medicine out. You're right. Um, so I really love a machine called the Flow Presso. Have you ever heard of a Flow Presso? Okay.
Low
You're gonna
presso, it sounds delicious.
You're going to geek out on this. So it is the best way for me to describe it is like a Michelin man suit. So it's got, you Velcro the arms on, you Velcro the legs on, you Velcro the torso on, and at the bottom at your feet, there's a machine that someone sets with your settings. And it's like a warm hug that starts from the bottom of the legs and the arms that squeezes towards the heart, all the way up, like rhythmically, like an ocean squeezing, and it has some infrared heat and microcirculation in it. And so it helps people to sweat by the end of it. And most people fall asleep because it's warm and it's moving your lymphatic system. Some people cry because a lot of our emotional memories are stored in the water of the lymphatic system. And it's really a beautiful 40-minute treatment. I hope that so many more clinics end up purchasing Flow because it's one of the nicest ways to move the lymphatic system, in my opinion.
Well, it's also for tissue repair after injury because many athletic centers and gyms are incorporating those compression devices, heat with compression, sequential compression, compress, relax type devices as well, right? So for performance.
It's wonderful. Absolutely. I also love, when I was rescuing my brain and not realizing yet that I had a B vitamin deficiency, I went and did things like neurofeedback and hyperbaric oxygen chamber, and actually own an hyperbaric oxygen chamber upstairs in my house here. And I love them. I think they're wonderful for people who have any sort of neurologic deficits or brain injuries. Any sort of wound healing that needs to be done. It's sort of like ozone that way too. It hyper oxygenates the body and the brain. I had it for my dog. My dog had a brain tumor, and I extended her life another 2 months with a giant brain tumor with a hyperbaric
Mhm.
oxygen machine and ozone. So,
Ho- So how did you get the dog in the hyperbaric?
they all get in. The first time she was afraid, and afterwards, she felt so much better. She was running and playing in the backyard with the other dog, and it was adorable. And so after that, she jumped in every single time because it helped her so, so much. She
Oh my
remembered.
gosh, that's so cool. Yeah, we use hyperbaric oxygen in our clinic too. Again,
Love
so
it.
many benefits to it, and
Yes.
certainly with neurologic disease, brain injury. But the fact that your emotional trauma triggered a traumatic brain injury,
Mhm.
that's huge. How did you know you had that?
Yeah, I actually went to a brain clinic. That's how concerned I was with everything. Now, you have to think about emotional trauma and stress on top of a B vitamin deficiency is pretty much a brain injury. So that's what I was experiencing. But I went to a brain clinic in Asheville, North Carolina, called Apex Brain Clinic. Great people. And they did a day of discovery on me is what they call it, where they put little glasses on you so they can watch all your eye movements because the eye movements really connect to the brain health. How your eye moves and perceives things is equal to how healthy your brain is. And so they looked at the way my eyes tracked all the different things very close. They would have me march in place to see if I veered right or veered left. They had me do the interactive metronome where you have to clap on the exact seconds of the cowbell. They had me do neurofeedback and hyperbaric oxygen as treatments after that because they are the ones who found the brain injury. And I haven't hit my head, and this was a new finding. Um, they are the ones that could tell me exactly where it was. They could say, "We could see that you don't like to let go of things very well." I said, "You can see that?" I said, "Yeah." So even a little ADHD like symptoms are from this brain injury. Not being able to track well and miss things that I was trying to hit on the screen with my left hand in the periphery. And that is exactly where they called it and said that would happen. So at the end of the week, I went and did treatment with them all day long for 7 days. And at the end, I was clapping exactly on the exact beat of the cowbell, not early and reactive like I was before. I felt so much better. I felt like the inflammation in my brain had been cut down. And my eyes were tracking better. Everything. You could see the improvement in their objective tests.
Yeah, that is so good that you did that because again, sometimes we just live with it, especially as a high performer or type A, right? You're going to power through no matter what until you can't anymore. And so like in longevity medicine, we look at, okay, well, what are you at risk for? What are you dealing with now? What's created this issue? And what are you at risk for in the future? And where can we intervene as comprehensively as possible to turn this tide around?
Yeah, what happened was I was having trouble finding gratitude and I was getting more and more irritable every day. And so I really was starting not to like who I was becoming. And so that really made me dig for answers and dig for reasons why I was feeling the way I was. So I encourage anyone out there who's experiencing anything close to me to like test, don't guess. Really go see someone who can help you. Really ask questions to I can't ask questions anymore because you are your own best advocate.
I love that. Say, put your Nancy Drew hat on and get to the bottom of it right away. Let's figure out what we need to do to fix it. Right?
That's
We're never broken, and you said that right at the beginning, right? We're not broken, and it's a matter of, okay, well, we need some fine tuning. As a woman that I met on the Camino de Santiago said, we need we're refining, in a period of refinement. Life is about refining ourselves, right? And I think that's just such a beautiful way to look at it, and very important to not give up. Not I mean, I really have to say that, so many times I see people, when they're desperate, and we do in functional medicine, right? They've been to
yes.
multiple providers, they've been to Mayo, they've been to MD Anderson, they've been to all these, big places. They've had their executive physicals, and they're like, just I'm at my wit's end type thing. And we're like, okay, well, let's get to the bottom of it. We address these issues. The neuroendocrine system is key, but gut immunology is really key to healthy gut brain connection. Can't emphasize that enough,
Yeah,
really.
and you guys saw that when I injured my brain, I injured my gut because the gut brain axis, the neuroenteric system, like you said, is just amazing. And my guts, if my brain's on fire, my gut's probably going to be on fire too, which is I experienced that exactly.
Mhm, mhm. Well, Dr. Jess, tell our audience how they can follow you on social, connected with you on your website.
Absolutely. So I always tell people there's a hierarchy to what you guys want to do and how you want to follow me and how interactive you want to be. So I'm really interactive on social. I know you are too. And so my big platform's Instagram. It's dr period jess period md. I also am on TikTok and Facebook as well. And then so that's the free way. I give a lot of information on there. I also have a website, drjessmd.com, where we publish a lot of blogs. I have a lot of free information. I have an FAQ that my audience asked me that I answered the questions on thereof. And then finally, the highest way to interact with me is my Wellness Plus platform, which is where I teach people how to be their own best doctor. So on that platform, we have an uncensored community forum where you can ask 3 different doctors questions. We have different protocols, hand-holding protocols and biohacks. And we really try to help people get to the root cause when they don't feel like they have any other answers. And that's a lot of fun too. I also have a supplement company that's Aegis Formulas, AEGIS formulas.com. And that's where, believe it or not, I sell liquid liposomal methylated B vitamins, glutathione, and vitamin C because that's what saved me.
Yeah, thank you for that. We'll put all the links in the show notes so that people can reach out to you. And I want to thank you for sharing parts of your story and also the solutions, like some direction. So we covered a lot of information in this podcast and this conversation, from ozone therapy for shingles and HSV and other immune issues, hyperbaric medicine therapy, how to address histamine sensitivity, and also, I think most importantly is to prevent burnout, right? To do the things on a daily basis that make a difference in the quality of our lives. So you guys, thank you so much for joining us. Thank Dr. Jess. Be sure to follow her on social. Check out her website at drjessmd.com. And as you know, I really appreciate you reviewing, commenting, and sharing this podcast with your friends, with colleagues that we know we want to reach to help them. So planting seeds, right? Planting seeds, growing a forest. I love being your girlfriend, doctor. Y'all, till next time. God bless you.